doing a piggyback med administration. I have a doctor's order here for some Flagyl. Some adverse reactions are seizures. Some symptoms are dizziness, headache, nausea, and abdominal pain. Action would be for a bactericidal drug that disrupts bacterial DNA and protein synthesis. Its use is for H. pylori and peptic ulcers. We are going to administer 500. The orders call for 500 milligrams Q6 hours, infused over 60 minutes, and 100 milliliters of normal saline with a drop factor of 10. So I took my math, and it's 100 milliliters over 60 minutes times 10, which gives me 17 drops per minute. And there's my math. Okay, thank you. And one thing, some adverse effects is a super infection. So we're going to go ahead and get going. First, I would clean my hands. I got my medication and my syringe, and I'm going to do half a milliliter of medication. So first I would, I don't know why I just took that off. Okay, there we go. I would clean my medication bottle, pull back half a milliliter, push in the air, and pull out half a milliliter of medication. Put that to the side. And that is now ready for me to add to my medication. I have my sodium chloride. What I'm going to do is I'm going to label it. So I would label it with the Flagyl, and the amount being put in, the date, the time, my initials, the patient's name, the start time, and the flow rate. So I would now, clean this, take my medication, I need to re-clean it. Oh, there we go, finally. And push my medication in there. Then this would go into the sharps container. Okay. That is and then I would gently mix my medications. Okay. I would then go ahead and get my tubing, and I would make sure that it is clamped closed, and get this, pull this off, and spike the bag. And then I would squeeze, squeeze, squeeze. For some reason, my thing does not want to stay on. Okay. I would then prime my tubing by opening and watching it flow through, which it's doing it, and then I would reclose it. Okay, so then I would take this and my alcohol swabs with me in my hanger daddle, and I would take that into the patient's room. This up. Okay, so this is ready for the patient. All right, so now we're going to go into the patient's room. I'm going to do clean my hands, and I'm going to go ahead and glove. Once I've gloved, I'm going to talk to my patient again and let her know what's going on. Miss Jones, I have an order here for you to get some Flagyl for your peptic ulcers. Have you had any allergies, or have you had this medication before?
I have no allergies, and yes, I've had this medication before.
Okay, and once again, if for some reason she had never had this medication again, I would sit here for 10 to 15 minutes to assess and make sure that she didn't have any kind of signs or symptoms. Miss Jones, I gotta look at your name tag again? Armband, I'm sorry. Can you tell me your name, first and last name, and your date of birth again?
Clara Jones, January 20th, 1942.
All right, everything matches. I would then assess the IV site. Everything looks good. There's no inflammation or edema, no infiltration. I would then go ahead and lower my primary med down to establish a positive flow. Okay, that's lower. I would then go ahead and get my alcohol wipe. I'm going to scrub the hub and attach my new medication. First though, I would have closed, I'm sorry, I would not have done that. Okay, I do that afterwards, sorry. If that was not clamped, I would have wiped that. Okay, that is now together. Now I would clamp the primary line and turn off the hose. I would then look over here and go ahead and get my drop factor, which was 17 drops a minute. So we'll go ahead and open this and watch it. All right, that looks good. Okay, I would also, before I would have brought the medication in here for my piggyback, I would have labeled my tubing with the date, time, and my initials. Okay, now that that's going, I'm gonna look at her site. Everything looks good. I'm gonna come back in here and check on her periodically. Okay, so I'm gonna leave and I'm gonna come back. Okay, it looks like the medication is done. So now we're going to go ahead and disconnect this. So we're going to turn this off. And I got to reestablish this, so I will then put this back up here. Because you got to reestablish a positive flow. Go ahead and unclamp. And go back to my drop factor of 16 drops a minute. Okay, that's going. This can just stay up here. And I would disconnect. The piggyback, and at this point I can add an alligator clamp for later use, and then I would ask the patient how she's feeling, and I would also clean my area, dispose of any trash and anything that needs to go into the sharp container. Ms. Jones, how are you feeling?
I'm feeling great.
All right, thanks, and we'll be back later to check on you, and that's it.